But performing facelifts for the past 30 to 35 years. Well, the purpose of a facelift is to really restore things to where they were in the past. The changes that have taken place, the whole point is to try to restore position and shape to where it was in one's youth, looking exactly like oneself and being extremely natural in the overall appearance. The ideal candidate is someone who has certainly enough changes to warrant a facelift, and of course that's to a great extent a personal decision. It will vary person to person. However, factors that really do play a significant role are skin quality. The better the skin quality, the better the outcome in general. However, the individual who has lost support along the jawline, the neck region, the mid-face, there are a few other ways of addressing this without, in fact, addressing those factors. It is not only possible, it's something we strive to achieve all the time. That is one of the principal concerns that individuals will have, and I do believe it's something that we address very successfully all the time. As I tell most of my patients coming in, you really do not want to look like half of LA. There are specific reasons why a facelift looks like a facelift. And that is skin is pulled, it's pulled in a direction that is not appropriate, a vector of direction that looks artificial, creating pulling of the side of the mouth, weird lines, etc. That is entirely avoidable. The technique we use essentially eliminates that as a possibility. Well, we make this incredibly seamless. Individual comes in, we have an incredibly private, exclusive facility at Caroline Point. Someone will come in that given day. Anesthesiologist will, of course, interview you, and following that, virtually the next thing one knows on the way home. So we can make it very comfortable, very pleasant, and yet some of the very best people in the business are working for us. Facelift is actually surprisingly quick to recover from. There is surprisingly little bruising. There's virtually nothing at all in the front of the face. What we do get is perhaps a little bit of bruising low in the neck, almost like a hickey-like appearance, can actually be covered up very quickly. The incisions that we make are extremely stealth in nature. The healing is very quick, so usually at 1 week, an individual can look very good. At 2 weeks, great. At 3 weeks, superb. Well, basically, a facelift is really addressing very, very separate issues than, say, a filler or an agent like Botox or Dysport. A facelift is designed to restore the structural integrity, if you will, of the tissues. It's to restore things to where they were in the past. Nothing that a filler could ever do. An example would be deep nasolabial folds, such as in an area like this. A filler is almost filling an artificial valley if things have come down and become very heavy. And so what the facelift is doing is restoring the basic support, the basic jawline profile, the neck appearance. And in fact, a facelift is somewhat of a misdefined word. It really is a neck jowl lift with mid-face resolution as well. So the whole point is to achieve the very youthful jawline, the nice cheek support, reducing a lot of the heaviness and the downturned appearance that starts to happen. A facelift is actually kind of a misnamed procedure. A facelift is really a neck jowl lift with improvement of the mid-face as well. So what happens over time as one gets older? There's generally a loss of underlying fundamental support in the facial area. And as that happens, then things start to come down. The jawline is lost. Some pre-jowl fullness starts to emerge, creating the jowly kind of appearance. The neck loses its fundamental support, both in profile and from front view. And there's a deepening of folds. These nasolabial folds and marionette lines start to deepen, and because they're kind of pointed down, the face takes on a sadder look, if you will. And so the facelift is designed to really correct that. And the correction is by restoring the fundamental support of the underlying structures. That is the key to the whole thing. It is not pulling the skin. That, I think, is the fundamental flaw of most facelifts performed in the country, that to a great extent are really just pulling skin. If you do that, they don't last. It does not look natural. This is exactly what you don't want to see. And this is what I think we achieve all the time, is avoiding that appearance. In our practice, we charge anywhere from $8,500 to, I'd say, about $10,500, depending upon the specific individual and some of the factors that we have to address. The biggest factor that plays a role in cost is how much neck involvement is there in this area right at the midline. If there is a great deal of heaviness and big platysma bands, that does require a fair amount more work in order to re-support that area, and we do have to add some additional incisions and a different approach to help tighten that area. That does increase the cost somewhat. So in that range, basically.